Hi to everyone out there. Welcome to the Force Society for Kids Mental Health monthly In the Know session. My name is Julie Collette and I'm the Force Parent in Residence here at the Kelty Mental Health Resource Centre out of BC Children's Hospital. We're broadcasting from BC Women's tonight, a slightly different location, basically just a different building on the site. We have a lot of different viewers, individuals, and in communities. Some of the sites are Abbotsford, Mission, Burnaby, New West, Chilliwack, Hope, Kelowna, and Tri-Cities, and there's a whole bunch more people, but unfortunately I can't see the table, the rest of the table. So I'm sure there's the island and Squamish, and sorry to everyone else that I've forgotten out there. Certainly there's Vancouver, but sorry, a little bit of a technical glitch there. Tonight's topic, how do you talk to your child or youth about their disorder? And I'll introduce the speakers in a moment. Just a few reminders. Next month's topic is depression in young people. I'm sure that'll be of a lot of interest. The other thing is, please fill in your In the Know feedback forms. Your community viewing sites will have those papers. If you're at home, please click on the presentation links at the top left of your screen. It looks like a paper clip, so you'll find the feedback form there. If you would like to enter the contest, you can enter your name and contact information to possibly win a $50 gift certificate. All the information is confidential, so we're just using it in order to collect data and your feedback for further funding, and we just want to know what you liked and how we can maybe improve things. So make sure to do that. The other thing is, if you have a question for either of the speakers, you can click on the little cartoon speech bubble, is how it's described to me, at the top of the page of the on your computer, and you can type your question. We'll try to answer as many questions as possible. We will be signing off right at 8 o'clock. So now I would like to introduce the speakers, which are Ross Robinson and Marlisse McRobie, or McRobie, sorry, meant to ask you what that was. First of all, Marlisse here, obviously, is the proud mom of a funny and talented 15-year-old son who has struggled with mental health issues since he was very young. Marlisse has become more empowered and has worked with the Force for over 2 years now, helping other parents empower themselves. She believes the path to empowerment lies in connecting with others with similar experiences, building a team of support around you, and gathering tools that help guide you and your child or youth through the challenges together. And Ross here has worked as a child and youth mental health clinician therapist in the Lower Mainland for the past 18 years. He has trained in psychology from both major universities in Alberta, in clinical psychology from SFU, and has practiced in hospital and community mental health settings in a career that spans, shall we say, 38 years. Ross works at the Youth Day Treatment Program in Coquitlam and also at the Maples Adolescent Treatment Centre. Ross is also active in wheelchair sports and holds a director position on the board of the BC Wheelchair Sports Association, the Force Society, and the Institute of Families. So thank you both for being here. Thank you.
Well, it's my pleasure to be here, and particularly to work together with Marlisse, because that's why I really like working with kids, to be honest, because it affords me the opportunity to meet with parents just like yourselves and Marlisse, and I think it's incumbent upon us as professionals to be aware that you're the expert with your kids. You're the one that spends 24/7 with them, and so I think we need to acknowledge that. So it's really a pleasure to work with Marlisse in presenting this today. So what I thought I'd do to begin with is that let's just outline some of the things that we hope to cover this evening, recognizing that we've got more information than we have time for, so that we may skip over some slides that you will have access to. So what we plan to start out with is I'm just going to make a couple of comments about the prevalence of mental health challenges with kids, and then talk about what may have brought you to this presentation this evening in terms of whether you have concerns about your child with respect to mental health issues and what kinds of things might that include. And then we'll spend some time talking about what that conversation is about, what kinds of things to keep in mind. And we'll also talk about what we see as maybe some helpful, maybe not some so helpful ideas around doing that. And then Marlisse is going to talk about her experience with her son. And we hope to do something that may be a little different, and that is to actually role play a couple of examples, and we leave it up to you to make a judgment as to whether they're helpful or unhelpful. Okay. So I'm probably going to date my, and then we have some, we'll leave some time obviously for some questions and discussions, and we have a resource page for you to look at as well. So I'm probably dating myself by opening with a comment like this, but there is no Dr. Spock book to help parents talk about this particular topic. And mental health challenges, just like physical illness, can literally happen to anyone. And for instance, here in BC, estimates vary, but 1 in 7 kids have at least one mental health concern. And so that represents over 140,000 children and adolescents. And as you can imagine, not all those people, young people, are getting service. And we're aware that understanding mental health challenges is difficult for adults as well as children. And there can be some myths and confusion and misinformation out there. And that causes anxiety for people, and that tends to promote stereotypes and stigma. And we will talk about that tonight. The other thing is that, when your child has a physical illness or injury, we tend to seek out professional help and try to get them any medical attention that they might need. So similarly, when we're talking about mental health challenges, it's important that we respond in the same way. So that highlights the importance of being able to talk to your child about their mental health challenges to help dispel some of that misinformation and myth. So let me move on to, this is where we're going to one of the things that we know is that mental health challenges in adults, for instance, when you interview people like that, they often say that they can think back into their childhood and adolescent years when things started, they were aware that things were happening back then. And so some of the confusion can be how you differentiate between the symptoms of a mental health challenge and normal problems that all kids experience at some time or another. So I'm just going to skip through to we're aware that many of you may be at different stages in terms of, and then maybe one of the questions that you are asking is there something that I should be having a conversation with my child about in terms of a mental health concern? So this is by no means an exhaustive or definitive list of things, but these are things that are reasonable to be concerned about. So certainly one of the things is when there's a decrease in the enjoyment of time spent with friends or family over an extended period of time, and not just because when you're moving from childhood into adolescence where that typically happens anyway. That could be one thing to be concerned about. Obviously when there's a significant difference in how your child is performing at school, and whether there's resistance to attending school, where they're late many times, or you're getting reports from teachers that they're being disruptive in class, or their concentration and ability to pay attention in class is a problem. One of the routine things that can happen is where there's big changes in their level of energy and motivation to do things. and certainly with respect to their eating or sleeping patterns. And when I refer to sleeping patterns, I mean where it can be they're not getting enough sleep, or whether they're sleeping in and they're hard to get up to get them going in the morning. Okay. The next one about stomach aches, headaches, and so on. Obviously, all kids experience that at some time or another. But again, it's in terms of whether this is a persistent thing that is happening a lot lately, and there doesn't seem, and you've had them checked out, and there doesn't seem to be any physical explanation for that. And Julie mentioned that the topic next week, I think, is depression. So the next couple of issues there may relate to this, where there's feelings of hopelessness, sadness, anxiety, they're crying a lot, or there's aggressive outbursts, or they're being really disobedient and lashing out verbally. In youth in particular, this is what depression can look like. As, you know, that irritability goes together with the sadness and those feelings as well. The next one's about neglect of their personal hygiene. The substance use is an important one in the sense that some kids, if they're having difficulty, self-medicate, and this is where particularly pot or cannabis can be used for this purpose. And if they're doing dangerous or illegal thrill-seeking kinds of behaviors, that's a concern if that's something new and a change. Acting overly suspicious of others, and together with that, where together with the hygiene thing. If we can move to the next slide. If they're seeing or hearing things that others don't see or hear, those are all sources of concern that may indicate that there's changes that are happening with your child. A key one here is if they have thoughts of dying, hurting themselves, they actually verbalize that life is not worth living. Again, many kids and all of us to some extent have maybe entertained the thoughts of that, when we get feeling down, life's not worth living. But if they actually go beyond that they've really thought about how they would do that and verbalize that is cause for concern, and probably you need to get a hold of your doctor or, depending on how serious it is, get them to emerge. So overall, there is a developmental perspective. It is different depending on the age of the child. I won't go into detail about that right now, but one of the things that to keep in mind that increases the risk that your child may be facing a mental health challenges is if there is a family history of mental health problems. The risk is higher. And with all those things that I've mentioned previously, if the problems are there and they are persisting for a length of time, and keeping in mind that feelings of sadness, worry, irritability, and sleep disruptions are common to most kids. But when it's intense, when it lasts a long time, when it starts to interfere with things like school, or if they're working, you get reports about problems in that regard. And certainly with respect to the relationships with families and others, there's cause for investigating those things further. So yes.
Okay. So when is it time to have that conversation? When you think it's time that you might need to have a conversation with your child about this, what you might want to do is focus on normalizing and empowering your child or your youth. Help them understand that lots of people face challenges like this. They face these struggles, and there are lots of things that can help. There are people that can help. There are things that they can do that can help, or to help themselves. And be prepared for some questions. What are mental health disorders? Who gets them? What causes them? those are some helpful things. Just be prepared for those questions before you sit down and talk with them. It's also important how you frame the concern yourself. How you frame those concerns yourself. What are your experiences? What are your cultural beliefs? Having a positive turn on that can be really helpful. You need to consider the impact on siblings and friends of children with mental health challenges as well. It might be time to enter conversations with them after you've done that with the child that you're concerned about. Some unhelpful things would be putting off getting help, thinking they'll grow out of it. Kids don't have a mental health problem. There can be a lot of pressure sometimes to look at it that way, but it's really important. We'll talk more about that too, but listening to your instincts and what's your gut telling you, that can be a really important piece. Another unhelpful thing would be giving up. The wait list is too long, or there's too much bureaucracy. You have to jump through all these hoops. It really is. It can be a very complex system, and it can be very, very frustrating. Knocking on door after door, and sometimes those doors feel really closed, and parents have to be really, really persistent sometimes in order to get the help that they need for their child. Another thing that's less than helpful would be giving into the stigma and shame. Carrying that shame with you as a parent, and allowing that to close you off from other people around you. That is a really big struggle that families face. So I would encourage you, not to keep it a secret from your friends and from your family. Break out of that, and all that can help reduce the stigma as well. Some helpful hints here. Again, trust your instincts. You're in the best position to know whether something is going on with your child or not. Trust that part of you that is telling you something. Be persistent. That's easy to say. It is a huge skill. It is a huge thing that we sometimes have to do. Because the earlier the intervention, the better. The sooner you start getting help, the better it is for your child.
Another thing that is helpful, this is timing is everything. This is not a conversation to have when your child is upset, but at a time when they're feeling safe and comfortable is more likely where that conversation is going to go better. And it's not the kind of conversation that lends itself to being able to complete in one conversation with your child as well. Be aware of breaking up the conversation. Or breaking it down into smaller, separate conversations. And that can happen over a developmental period of time that Marlisse will talk about when she refers to her own experience. Next, it's if there is a spouse or partner involved, I really would encourage you to share the responsibility for that conversation and do it together. Don't leave it all up to mom or dad. That I think that helps the child recognize that this is a concern for both of you and that you're taking it seriously. Okay? The idea of using empathy in I statements. Empathy is a skill, and we can certainly learn more about that. To define it, it's trying to experience the feelings of someone else as if they were your own. So it's like stepping into somebody else's shoes, in this case your child, to try and find out what their experience is. And that's one of the things that's helpful in initiating this conversation, is using your observations, any changes in behavior that you've seen with your child and their personality as a starting point. And to indicate, look, I'm concerned about this. I've noticed these kinds of things over the last little while, and I just want to know, what that's like for you. So the goal is really to understand what it's like for your child. It's not a time to pass judgment or to offer critical opinion. If anything, it's putting your own feelings aside while you really try to focus on what's going on with, and hopefully the role plays that we'll do later on will help illustrate that. Keeping in mind that both kids of any age, when something's not right, not going well, there is a tendency to feel like it's something they did and want to blame themselves, or in fact maybe blame you as the parent. So it's important to communicate that there's mental health challenges no one's fault, and it's not contagious. They're not going to be passing it on to their friends.
Something else that's really important to keep in mind is talk to your child at a level that they can connect to. So if your child is very young, keep the sentences really short, really direct, using simple terms. As they get into the middle years, middle school years, you can elaborate a little bit more, and then as they become teenagers, youth, that has its own special set of challenges, but speaking as the mother of a 15-year-old, but you can get more involved with a conversation with them at that point. Usually, it would be a bit more give and take. You might be able to expect with some youth. However, some youth may be more closed off about it. They may be engaging with their peers and getting the information and their concerns met through that. So, you might have to make slower, smaller inroads and overcome that. Another thing, this is something that we do, is we make use of everyday opportunities to reinforce ideas of self-care, empowerment. We use things like news stories, celebrities, something to make it real and relevant. And this I do more for our teenager now than before when he was younger, maybe not as much. But it just helps to keep the conversation going. And it's just something that comes up at our table quite often in general terms is the subject of mental health. Something else that's really, really helpful for them to understand and for them to overcome that stigma, and for yourself as well, I guess, is to draw parallels to other forms of illness that, to help you understand that this is just something that needs to be treated. Maybe use of medication, maybe not, maybe lifestyle changes, maybe, professional help, that kind of thing. Some examples that we use, diabetes is the one that we favor in our house. We talk about, having a mental health challenge may be a lot like someone having diabetes. There are different things that they have to do. There are different things that they have to watch out for. A doctor is likely going to be involved. Some people with diabetes need medication, that kind of thing. Some others that you might be able to draw parallels with would be asthma, epilepsy, that kind of thing. Whatever speaks strongest to you, makes the most sense to you, that would be what I would encourage you to use. Another really helpful thing is get educated about the particular mental health challenge that you're dealing with. That way you're coming from a place of knowledge instead of maybe a place of fear. Not knowing, it helps eliminate the shadows of the not knowing sometimes. So. And then that way you can break that down into bite-sized pieces to your child so that they can help understand what it is that they're facing. This one is really big, for me anyway, was to get connected with other parents who are facing similar situations. For a long time we battled our path trying to get help for a child, and when we hit a really big crisis, when he was in grade 4, I thought, wow, if we're not the only people in BC who are going through this, we have to be the only people in the Tri-Cities who are going through this. And when I first got connected, thankfully, with Jeannie many years ago, our stories bore a lot of similarities. And the first time I sat down in the group with everybody, my husband and I went, and I sat down in a room full of people who understood. So that was really, really powerful and really empowering. So I would encourage you to consider that if that's something that fits into your life. Another thing is to Oh, Ross, you were going to talk about...
Sure. I would
Yeah.
just what I was saying before in terms of initiating the conversation about things that you've noticed or that have changed. Let your child be the or youth be the guide in terms of how much, to try and answer that question, how much is too much information to give them, so that you may need to slow down and go back over some information that you're covering with your child if they get confused or upset. And what I wanted to add is that there's, be prepared for a variety of reactions that you may get from your child, and this can range from actual relief that that there's a recognition that you know that they're not feeling well, and they know that, and that there's a sense of hope that that treatment is available. But after they've had a time to think about it, it may be that they're fearful about what all this may mean. They may be confused. They may have a lot of questions that they don't have answers for. And certainly it can also be that they get angry. Why me? Any of us in that situation, I think, can relate to that. And a couple of things I just wanted to throw in here that are not on your slides, but in connection with that. Sometimes it's important to help your child realize that mental health challenges are not always well understood by some of their peers at school and their friends, and even other adults for that matter. So they, out of ignorance, may make fun of your child or say things that aren't true. In fact, not knowing what to say and turn away. And so part of the conversations at some point might be looking at strategies, practicing and rehearsing strategies of what do they want to say to their friends and other important people. The analogy I use is I have a physical disability, and do I tell everybody that I meet that I have polio? No, but those that are important to me and that matter to me, yeah, I'll give them some sort of explanation, because they may in fact be curious but don't want to say anything. Okay. The other thing that I think is important to add is that to be aware that in this situation where you have siblings of the child that's affected by a mental health challenge, they may be just as confused and just as concerned and just as worried as the adults in the family. They know something's going on for their brother or sister, and that something's changed, and they can certainly feel the tension in the home when this is presented to you as the parents. So they too may need an explanation as to what's going on, with the message that it's important to be supportive and positive and optimistic in terms of being supportive to the brother and sister, and recognizing that help is available. That also helps dispel some of the myths and confusion that is out there about mental health challenges. Certainly provide reassurance that help is available, and as was pointed out, in trying to navigate that system, which shouldn't be that way, but it is, unfortunately, that you'll be there with them along the way. That's really important, that you're in this together, and that what's really important too is that your son or daughter knows what to do and who to call whenever they don't feel safe. And finally, remember that if the conversation doesn't go particularly well, it isn't over. In fact, it's a very powerful experience for kids when you acknowledge that we make mistakes. We may not come at it the way we would like to, and can we revisit this? I'm sorry, it didn't go well. Can we try this again? So the idea of repairing what's happened and recovering and using another opportunity to have that conversation is really important. Keeping in mind it doesn't happen all in one sitting. It takes time and in many conversations.
Mm-hmm. Something else to consider there is if it doesn't go well, just be gentle with yourself.
Exactly.
It's really, really tough thing to be facing sometimes, and your child might have an unpredictable reaction to this, and you might get triggered as well. And that's okay. You can go back, you can repair those things. we've said sorry in our house more than once. And also just, reconnected and, at the end of it said, well, okay, that maybe didn't work. Maybe we can talk about this again another time. But just be gentle with yourself. Don't beat yourself up if it doesn't go well. I wanted to share a bit now about some of the big discussions that we've had in our home. We've been dealing with our son's mental health challenge since he was a very young boy. Right from age 3 was when I really noticed that things were difficult. I maybe didn't realize what we were dealing with, but I sure got a lot of phone calls from the daycare and an invitation not to come back at 1. And so we knew from an early time that our path started early. As things developed, I noticed, as I was thinking about this discussion, I noticed that there are themes to how we approach a discussion with our son. And there are basically 4 main themes that we cover, sort of the intention behind a message that we give. The first one is that we look at these things as a challenge, not a problem. And the reason why, it may sound like a bit of a word game, but I find it powerful. A problem to me is something that's negative, that has a negative meaning, a negative message. My husband pointed out tonight that a problem is something that you fix, right? You're going to find a solution and then it'll be fixed. The things that our kids deal with tend to be longer lasting than that quite often. So a challenge to me is something that you rise up to. It's something you meet, you try to overcome. And we don't only frame this like this for our child, we also do this for ourselves, in our own thoughts, how we think about this situation, and also in the words we use when we're talking about this to other people. The second main theme is that your diagnosis isn't an excuse for behavior, but a reason why some things may be more challenging for you. It doesn't mean you can't learn to control it. It just might be a little more difficult, or sometimes a lot more difficult. It may take you longer. It might look different. You may need things to help you, or tools to help you cope. So that's one of the big main messages there. The third one is that everybody faces challenges at some point in their life. It doesn't mean that you're bad. It doesn't mean that there's something wrong, something broken with you. We'll go back to the diabetes example that we mentioned earlier. Say someone with diabetes is going to have all kinds of symptoms possibly that may hint that something is going differently for them, something's going on. Once they find out what it is, okay, this is diabetes we're dealing with, there are lots of things that can help. Professionals, possibly medications, lifestyle changes. There's an increased importance to good self-care. Families may need to make adjustments too. Mom and dad may have to learn how to cook meals a little differently. Does that mean that they were bad cooks? No. So just like that, we also use that as an analogy for ourselves. We may have to parent a little differently. Did that mean that I was a bad parent? I wasn't perfect, but I wasn't a bad parent, and neither was my husband. So those things are things that we found really helpful. The other piece of that is that even though you have this challenge, you can still lead a really full life. There are lots you can still do. There are just things that you need to watch out for and ways to help you get through the hard times. When the fourth main message, and this one is really, really important, and it can be more challenging, and it took some time to get to this place. When we were in crisis, when he was in grade 4, we weren't there. But now, when possible, find the gifts and the challenges. The gifts that have been brought to your life because of this, or to our lives, I'll speak for me, and to my sons. For example, it changed my parenting because he was so challenging to parent. I'm now a way better mom than I would have been without having to face this. It also made me dig really deep. I had to seek help. I had to, lead my own inner journey so I could be really strong for him, which helped me to heal a lot of things from my past that needed healing. And as a family, and as a couple, part of a couple, working through this together, has also forged our bonds really tightly. To say that it hasn't been easy is a big understatement, but we try really hard to be on the same page with each other, and we've learned the value in that. As for my son, it has brought him many gifts as well that will serve him throughout his entire lifetime. He's honed a remarkable sense of insight and self-awareness that are well beyond his years, an ability to advocate for himself when needed, great problem-solving skills, an ability to hyper-focus on something he's interested in, and he knows who's around him as well who can help when he's having a difficult time. I'll just go over briefly some of the big conversations that we've had. Those are sort of the major themes to the conversations, but some of the big conversations that we've had. When he was in grade 1, we had finally gotten to see a psychiatrist, and I was going over papers to try and decide whether to put him on the medication or not to put him on the medication. And he'd been part of the conversation earlier at the doctor's office, and he asked me what the papers were. And I said it was for medication, and he said, well, medication for me? And I said, well, maybe, that's what I'm trying to decide. He said, will they help me? And I said, well, that's what the doctors think. Can I take them, Mum? That was really, really a powerful moment for me, and for him too. I strongly believe that him being a part of that and being a part of that decision helped buy him into the whole process right from the word go. In grade 2, it was, the pills weren't magic. It didn't cure everything, but it certainly helped in some ways. But he had lots of bad days, and after one particularly hard day, he told me that he didn't want to take the pills anymore. He didn't want to have ADHD anymore, and the pills were giving him ADHD. And I said, I was strong. I didn't giggle or anything because I found that humorous, but I got down on his level and I explained to him, well, the pills don't give you the ADHD. They only give you extra time to make the choices, and that they're still your choices. So that was an important piece for him, I think, important piece for us. Grade 7, we were facing some pretty serious times. It was a possible psychotic episode that he was going through. We spent a lot of time in the office over about a 2-week period, and one day he called up from the office, and he was really, really angry, and said, Mom, I don't know if I can control myself. I feel like I'm going to hurt somebody, or I'm going to break something, and I need to leave the school. And I'm scared to walk home. I don't want to walk home because I might do something. And instead of, I was proud of myself for this, because instead of going, oh geez, why are you in the office this time? What happened? Instead of responding that way, I congratulated him, and we celebrated the fact that he reached out for help and let us know. So lots and lots of praise came because of that. Another thing at that point in time, so this again is the middle school years, we helped him to identify some of the concerning symptoms that were happening and encouraged him to share those with his doctor. So starting to help him formulate how to engage with the doctors. Grade 9 and 10, I've mentioned this a bit already, is, we talk a lot about it at home now in general terms, and we use examples from celebrities, news, family, friends, when appropriate. Charlie Sheen was a gold mine. The stuff that Charlie Sheen went through, that came up in our house a lot, and what we focused on there in general terms was, talking about drug use and the possible effects that it had on mental health challenges, and what a person can lose, what's at stake if they're not looking after themselves. Catherine Zeta-Jones, on the other hand, was another one that we talked about, with her coming out about her bipolar challenges. My first reaction to that in the discussion we had was, wow, I'm so excited that she came forward with that, and how much that may help to reduce stigma, and I'm really glad that she's opening up and getting the help that she needs. Nowadays the focus is a lot on self-care. The discussions that we have are focusing a lot on that, on reducing stigma, and on life successes or challenges brought on by crisis or the lack of self-care. And using lots and lots of empathy whenever we're talking about that, both when it's other people, celebrities, or what have you, or about things that he might be going through. So.
Okay, now we're at a point where we would like to do a couple of role plays, and I'm conscious of our time. We do want to leave some time for some questions at the end. So we're going to do the first role play, and these are the questions that go along with that. And so I'll give you some idea of the circumstances, but what I really want you to focus on is just watch us do the role play, and then focus on what it was like for the youth. Okay, to begin with, we will also ask you what you think about what's going on for the parents, but as an example of trying to get into your child's shoes for a minute, that's what I'd really like you to focus on to begin with. Okay, so the first role play. I am the youth in both the role plays.
I'm the parent.
Makes sense. And so all I'm doing is I'm sitting in front of the TV playing a video game, and then the parent comes in.
How long have you been playing that damn game?
I don't know, a while. Can you move? You're right in the screen. I'm trying to watch the screen.
Listen, don't you talk to me that way. I got another phone call from the school today from the vice principal. Again. It's the third time in the last 2 weeks.
So what?
I'll tell you so what. He told me that you skipped out again, and now you're home early, you're behind in your work at school, and when the teachers try and talk to you about it, you get rude and leave. What the hell's going on?
Nothing. Okay? I'm just trying to finish this game. Is that all right with you? Get out of here. Leave me alone.
That's it. You don't speak to me that way. You're grounded, and that game is mine.
That's just like you. All you think about is what the school has to say, okay? Well, go ahead. Take the damn game. I don't care. I'm going to my room, so do what you want. I don't give a crap. Okay. So, first of all, what behaviors did you see for the youth? I'll give you some time to... And we're just going to get a sampling, okay? We won't probably get for everybody. Well, just observations of behaviors, but you could also talk about what you think the youth was thinking and feeling in that role play. And similarly, after that, what was the parent thinking and feeling? So there's no right or wrong answers to these questions. We just want to get some ideas of what people noticed. Okay.
We should invite the PIRs to type a sampling of the responses in. If you could, that would be really wonderful. And then we can talk about it here.
A whole bunch.
Excellent. Way to go, guys.
So the Tri-Cities have said, I want to avoid offensive or defensive, not being heard, guilty, embarrassed. Mm-hmm. Why didn't she leave? I play my game to escape you. So that was a lot from Tri-Cities.
Do I live with any of these people?
Monica, from my parents, she said, needed time away, rudeness, defensiveness, oppositional. So a lot of similar comments from all of just that the kid wasn't being heard.
Okay. Great job in terms of identifying with what you think might have been going on for the youth. Is there comments about what you think might have been going on for the parent?
Looks like more are coming in. So again, the behaviors, I'm not sure if they're talking, who they're talking about. I think it's both. Annoyance on both parts, irritated.
On both parts, right.
On both parts. Internalizing and blaming. The parent was blaming and either saying the child was guilty without discussing it with the child first.
So passing judgment.
Oh, and something else is coming in. And from the Vancouver group, angry, defensive, body language, no connection between the two, escalating anger leading to a total disconnect. So I think everyone immediately, it seems, felt so strongly for the youth. Yet, of course, the parent is also feeling most of these things.
Yeah, and what else? Well, think about what the parent, when she made reference to, you don't talk to me that way. Like, what do you think the parent was thinking and feeling in that situation?
And it says here for the adult, controlling, argumentative, domineering, and in his space.
Wow. Okay.
Well done. Well done.
Yes. Okay. So let's try another version. Okay. And again, we're not saying that this is the way to have the conversation. These are just a couple of examples. Okay.
I'd like to comment too that first role play, we've lived that multiple times in our home. I mean, it's never perfect. So just if that's ringing bells for you, that's okay.
This is a bit of an experiment, so we really appreciate how people have responded.
Yeah.
So
Excellent.
same situation. I'm the youth, and I'm sitting on the couch playing my video game in front of the TV. Okay.
Hey, hon, you mind if I sit here with you for a minute?
I guess, but I'm kind of busy with this game, Mom.
I can see that. It just struck me. You're home early again today. You seem really tense. How are you doing? You feeling okay?
Yeah, I guess.
You don't sound very convinced. I wonder if you could pause your game for a moment and maybe we could chat.
I suppose so. What's the problem?
Well, it's the third time that you've come home from school early in the past 2 weeks. And I just wanted to let you know, too, that I got another call from the school. And they let me know that you're really getting behind with some of your assignments and that you haven't been very respectful to your teachers when they try and talk to you about it. I've also noticed that you've been really quite irritable lately, and it just doesn't seem like you. So I just wanted to check and see what's going on for you.
I don't know. Nothing, really. But I haven't been getting much sleep in the last little while.
Thanks for telling me. Well, I've noticed that you've been up a couple of times in the night, and I imagine that makes you feel pretty tired and hard to concentrate at school. I've also noticed that you haven't been eating a whole lot. I'm just concerned about how you're feeling, hon, and how it's affecting your health. Can you tell me more?
There's not much to tell. I'm just tired, okay, and I'm bored with school. Everybody there tells me I'm such a loser, and well, maybe they're right. Who cares? I don't want to talk about this anymore, okay? You won't understand anyway.
I can see you're getting really upset about this, and you're right. I don't know what's going on for you. I'm sorry that you're not feeling great. I hear you, though. I won't ask you any more about this right now, but I would like to know more because I love you and I care about you, and I want to help you in any way I can. You're not alone with this, sweetie. Maybe we can look for help together.
I don't know. I'll think about it.
Okay, that's great. Getting help is what counts. How about we get some hot chocolate and you can finish your game before dinner time. I'll check with you about this later, okay?
Sounds okay. Same questions. Focus on the behaviors first. What did you see for the youth and then for the parent?
Okay, one comment that already has come in from Vancouver group. The child didn't seem as upset because the battle wasn't a battle. The parent asked questions to get engaged with the child, a softer tone of voice, more engaging and empathetic, and wasn't accusing the child about the call from the school, but just trying to find out the root of the issue by asking questions and then validating the responses.
Mm-hmm. Great.
So, good answers from Vancouver.
Nice
Absolutely,
answers,
yes.
yeah.
And it looks like some more coming in a sec. Oh yeah, here we are. It was much more of a collaboration, and it was between the child and the parent, as opposed to just being the parent attacking before. And the wagging of the finger was a real clue. Yeah.
Okay, quickly in terms of thoughts and feelings of the youth and for the parent, because we do want to leave you some time for a couple of questions.
And it said here, the youth appeared calmer and not closed off, and of course didn't feel attacked, and felt getting it off of his chest. He reluctantly started talking and then begrudgingly offered tidbits, shall we say.
And I don't think that's particularly unusual, especially for a young person, a teenager, where they're likely to still give you some attitude, even though there's an indication that there's a willingness to explore this further. So don't expect that they're just going to buy in right away.
And Victoria said quickly, youth and the parent both heard and participated in the conversation with respect, that calm equals calm. And that in Penticton they said that the situation, the youth was disarmed.
Good point.
And rather than defensive, and not really open to discuss verbally, but way more open body language. And the empathize, the concern, the calm, and responsible for supporting the youth. And clearly it looked like the youth was heard, and the parent was calm and respectful.
Okay.
Great.
So the last question was, how do you see the second role play, or this last scenario is different from the first one? In many ways, many of you have already answered that question. So as I pointed out, we're not trying to say this is the best way to do it. It is simply one scenario, and but this is a challenging conversation, and it is not one that can happen just in one sitting like that. So I think our parting message would be to you that it's important to kind of get the ball rolling as best you can, and you'll find a way in your own way to have these kind of conversations, and be aware that, as I said before, if it doesn't work well the first time, there's ample opportunity to go back and revisit that.
Absolutely.
Okay. So I know we've left very little time for questions, but feel free to.
Oh, okay. Okay, similar comments, not questions yet, but send them in. Again, parent calmer, less controlling, milder tone, connected with son, empathy, but kindness was also shown, and respect. And the youth, the feelings of not belonging, not accepted by peers, and sad. yeah, that was new information
Right.
to the parent.
Yes.
And building trust came up, more connected, body language, a lot more open.
And did you see, and it sounds like you made this observation, that the door was open for further communication in the second one, more so than in the first one. It was more slammed shut in the first one. We tried to demonstrate that as much as possible.
Yeah, and from, I'm not sure if it is Victoria or from Victoria, but more of an opportunity for problem solving in the second. Not necessarily
Absolutely.
at that moment, but perhaps after the hot chocolate.
Yeah, the door is open.
Thank you for all those. Those are great comments. I really appreciate that.
Oh, and we do have a question.
Okay.
2 questions. One from Gina. How do you control or reduce the anger and frustration when advising your child of their diagnosis? So how do you control or reduce the anger?
I think you name it. Like, as I said before, if the reaction you're getting from your child is in that vein, to remain empathetic, as we were, is to say, I can see you're really getting upset. Name what it is, and that may be an opening to explore what that's about. It may be that maybe now's not the best time to talk about this. We can do this later. I think what was demonstrated, particularly in the second role play, or at least the attempt was made, is that it by no means was Marlisse in this situation not getting across that there are concerns. There is something that there's changes that have been noticed, and I think you have to be honest with your kids about that. And if their reaction is anger, to say, okay, I just want you to know I'm really concerned, and I'd like to talk to you about this further, but if you're getting upset, maybe now's not the time. I don't know if that helps.
And there's a few more questions, so I can combine 2. One of them was either what if the child shuts off completely, or what if the child throws the gaming controller at you? So how would you handle either complete refusal to engage or aggressive? Yeah.
You want to try that?
Outburst is more what would happen in our home. Our son goes out this way instead of keeping it in. And with an outburst like that, I would give him time to calm down. I would recognize again, I can see you're really frustrated about this. It would be really great to have a chat, but now might be a really good time for us to do something. If he was younger, perhaps it might be time for him to go take some time just to calm down in his room, do something soothing. But let him know that it was something that I would still want to, if it was something that we could engage in, something that we could talk about together, that would be a really helpful thing. And then I would maybe try approaching it at a soothing time. Gaming, I find my son is much more easily aggravated when he's gaming. So that type of talk in our house would probably more likely happen around bedtime. That's when he tends to be more open and vulnerable, and seems to be quite willing to talk. It could be a stalling tactic. We've suspected that more than once, but sometimes there are benefits to that. So, think about your own lifestyle. When can you catch your child being quiet? When are they in that open space?
I'll just throw in quickly, and hopefully this will come across, that sometimes people don't understand or don't recognize that you can do some limit setting and still do that in a respectful way. For the kid that throws their gaming system at you, you can definitely let them know it's not okay for you to do that with me. But I can understand that this is really hard for you, and but it's it's certainly not okay for you to do that. Maybe what you're telling me is this is something we need to do at a different time. But so it's a matter of not letting that throw you off your game as much as possible, but recognize that it may be part and parcel of what they're going through and the frustration that they're experiencing. But don't sugarcoat the idea that it's fine to throw stuff at me. No way. Okay.
Thank you. I think you answered those in 10 seconds or less, and that was really great. I'm just going to quickly read two more questions that the groups out there perhaps could carry on with answering them, because we just don't have the time. But one of the questions is, how do we prevent our children or youth from using their diagnosis as a crutch or excuse? And the other one, I think you covered that a tiny bit, but the other one is a parent says, I've had both types of conversations with my son on numerous occasions, and still just can't seem to make a difference in any way. Any suggestions? And I guess that's a bit of a dialogue. I know talking to them in the car often is helpful because they can't go anywhere.
Yes.
Captive audience is helpful, but I think that's something to discuss in the group, and hopefully we could maybe post on the website some of the answers to those that the groups come up with, so that the individual may have some tips.
And again, be persistent.
Yeah.
Okay? It takes time.
Yeah, it does.
So thanks very much. We are signing off. It's 8 o'clock, and drive carefully, everybody out there.
Thanks again.
Thanks.